Are we the problem that lies in the children as type 2 diabetes becomes one more thing that is having an impact in children living in our communities? Children with type 2 diabetes has gone from making up 5% of children to now, in the last 20 years on the rise to 20% of children. This could be your child, your grandchild, niece, or nephew. But the real question is how these pediatric patients can be more compliant with their specialty care service to help with these problems that are impacting children all over the world, especially in the Miami-Dade County area. Your neighbor, your child's friend, a schoolmate, and many other children didn't ask for this. Now ask yourself this question, because there is a bigger answer.
A treatment plan is obviously something that is necessary for their health or their well-being, but teenagers are difficult. They want to do their own thing. So oftentimes it takes a variety of different ways to approach the teenagers. You have to build trust with them. Building trust is essential to get a patient to adhere to a treatment plan. So it's no different with children and with teenagers and with families. And you also have to see what's in it for them sometimes. So a teenager who doesn't like their acne may be much more likely to take the medications and the creams that you tell them to do in a more disciplined way than if they really didn't care about it. Now, obviously, if they don't care, they don't want to come and get shots, but it's important for them to get their shots, then it's really about explaining to them, seeing it from their perspective. What are they afraid of? Are they afraid of the pain? So it's not always about your perspective as a healthcare provider. It's why is it that your patient doesn't want to follow through, or what could make them encouraged to follow through?
My game plan is education, because education's knowledge. It's like lifestyle modifications. It's educating about the disease, what their medications are. Once they know what it's for and why they need it, they'll be more proactive about it.
I think that in light of the setting, the time limit with the current healthcare system, the fact that physicians have to see a number of patients, which means that the amount of time that the physician can spend with each patient is not as much. They give you some information as well as literature, as well as pamphlet, with the hope that you're going to read through the pamphlet. But I do wish that it was a little more thorough.
I'm lucky because I do household visits, so I can spend like 2 hours with a patient and really dive deep in everything. They put patients in 15-minute, 10-minute slots. I don't think that's enough time to even get anything done in that short amount of time. People do, but like we were saying before, it's fragmented care. You're not really getting the complete person as a whole. You're not explaining them their diagnosis. You're not sitting down with them and saying, hey, what questions do you have? Because you just got diagnosed with diabetes, so I'm sure you have questions.
The issue is that when you as a patient, you come to the doctors, you have a list of questions that you want to ask. It's about the rapport that the doctor has with us, with Natalie's physicians. I had the same physician for a while until her practice changed. Then I went somewhere else, very schmancy Aventura. Didn't like the rapport, didn't like the connection until now, Dr. Amati. She looks like she genuinely cares. She took the time, had these conversations with us, and helped us understand how to tackle what we need to tackle.
Sometimes people feel that they can't ask their clinician questions. They feel intimidated or whatever it is. So ask them questions and see, hey, are you taking your meds? Or why are you not taking your meds? Why have you not picked up your medication?
Oftentimes what can happen is a parent has to lead. So it really involves all of us as a community, and who teaches about that is wherever the opportunity is and the teaching needs to happen, that's where it needs to happen.
You have to meet them where they are. You know, what I liked about Dr. Mahdi for us, she was trying to get us to eat a little healthier, and she suggested subtle changes to begin. But we have to confess, have we been able to do what she asked?
Sometimes.
Yeah, but we're gonna try harder, right?
Mm-hmm.
Every time you go to a doctor and they time you, that means you're not gonna get the best
the best information and your time, like 20 minutes, 30 minutes the most. That's how much you have to spend in the clinic, and you gotta go next.
I mean, I understand the limits set for the physicians too, and they rely on their support staff to provide you with the information.
With time constraints, it's a little more difficult. If you have 15 minutes, that's hard to even establish trust with a patient and establish like a relationship, a partnership with them, and say, hey, what do you understand about your disease? What do you think about these medications? How are you taking them? And kind of ask more questions.
Sometimes there are more patients than expected because of the no-show rate at clinics. Doctors have to schedule 3-4 patients in a time slot just because the odds are that people are not going to show up.
We're not just treating an illness, we're treating people, human beings. Therefore, it is very important that we address the whole person, and social determinants of health is who they are, what they live, everything that's around them in their life.
We were going through something when she was 4 years old, something with her digestive system. That doctor called us on a Saturday evening because we were at a point where things were tough for her, just to see how we're doing if the medicine worked. And we were in crisis mode with her. That call meant everything to me.